Hello. Today I'm going to talk about the topic yoga therapy for insomnia. So today we live in a world that trains our nervous systems to stay permanently turned on, leaving our bodies physically incapable of transitioning into deep restorative rest. So today we will look beyond quick fix sedatives and explore how yoga therapy systematically recalibrates the mind and body, offering a sustainable evidence-based cure for chronic insomnia. So sleep is a universal need shared by all living beings, and has been part of evolution since ancient times. Ayurveda, the traditional Indian system of medicine, identifies three pillars of health, including ahara, nutrition, brahmacharya, energy management, and the last one, of course, is sleep, nigra. So, which together sustain balance of mind, body, and spirit. So sleep quality is vital for repairing tissues, calming the mind, and building ojas, the subtle energy linked to immunity and vitality. So disturbed sleep can lead to both physical and mental disorders, making healthy rest essential yet difficult in modern life. And so we're going to look at some perspective of sleep. So historical ancient civilizations with sleep and dreams through a spiritual lens, heavily relying on deities, philosophy, and priestly dream interpretation. So, by the Enlightenment, intellectuals began analyzing their own dreams, though the general population still suffer from poor sleep conditions and vermin infestation. So, by the late 1990s, scientific research expanded into specialized fields like circadian rhythms and shift work, leading to a creation of over 200 US sleep centers. So sleep regulation is driven by the interaction between the homeostatic sleep drive with peak sleep pressure during wakefulness and the circadian rhythm with aligns alertness within the 24-hour light-dark cycle. The transitions between sleep and wakefulness are stabilized by a neurological flip-flop switch where wake promoting networks and the ventrolateral preoptic nucleus mutually inhibit one another. So once asleep, the brain transitions through alternating NREM, including the stage 1 and 1 and 2 and 3 uh, in the chart, and the REM stage that form 90 to 110-minute cycles throughout the night. So in yoga philosophy, sleep or nigra is regarded as a distinct mental state and even a gateway to higher awareness. Tranquility of mind may also be attained by meditating on the knowledge gained in dream and sleep. So sleep and dreams are not vivid, are not void, but contains wisdom. So from the Ayurvedic perspective of sleep, we see that sleep or nigra is one of the three pillars of health. So without proper sleep, immunity, digestion, and mental clarity suffer. So dosha's imbalance can cause sleep disturbance. It depends on which dosha. For example, for vata imbalance, it can cause insomnia because of its restlessness of the air ether quality of vata dosha. And for pitta, it can cause heat and irritability waking midnight. So beyond the essential brain and cellular processes that occur during sleep, rest profoundly influences many aspects of our daily functioning, including like memory consolidation and learning, communication skill, stress regulation and resilience, self-control, and decision making, thought processing and creativity, emotional balance and regulation. So research indicates that the quality of sleep more than the sheer quantity plays a stronger role in overall well-being and daytime performance. So three key components define good sleep, including the first one is duration. Sleep should last long enough to leave a person refreshed and alert for the next day. The second one is continuity. It means sleep should be uninterrupted without frequent awakenings or breaks. And the last one is that sleep should reach a level of depth that allows the body and mind to fully recover. So, what is insomnia? Insomnia is a disorder that makes it difficult to fall asleep or remain asleep through the night, ranging from a mild inconvenience for some to a serious disruption for others. So, few types of insomnia, like acute insomnia, I mean, um, short-term sleep difficulties lasting less than um, persist for 3 months or longer for at least 3 nights per week, or comorbid insomnia that occurs alongside or as a result of another condition, or maintenance insomnia that trouble staying asleep, and onset insomnia is difficulty initiating sleep at night. So, what are the causes of insomnia? The three P's framework introduced by Dr. Arthur Spelman explains how insomnia develops and persists through three interacting categories of factors like age, genetic medical conditions, uh, or lifestyle habits, or deadlines, trauma, illness, or medical treatment, or behaviors and thought patterns that sustain insomnia after the original triggers has passed, including excessive time spent in bed, sleep environment, poor sleep hygiene, late night screen use, caffeine intake, or irregular napping. So Ayurvedic purposing of insomnia, because insomnia is considered as a disturbance of balance in the body and mind, often linked to the imbalance of two main doshas, vata, which causes restlessness, anxiety, and difficulty falling asleep, light interrupted sleep, and pitta is which causes heat, irritability, trouble falling asleep due to mental intensity, vivid dreams, overheating at night. So Ayurveda emphasizes that chronic sleep loss weakens immunity, reduces mental clarity, and lowers quality of life. So some of the most common contributions to insomnia, including genetics, abdominal brain circuit, medical conditions like short-term illnesses such as COVID-19 or injuries, or chronic issues like heart disease, asthma, or biologic hyperarousal, mental physiologic activation, or lifestyle changes like jet lag, new work schedule, or lifestyle lacking of exercise, watching stimulating TV shows, reading stimulating books, or drinking or eating too close to bed, etc. Insomnia can manifest in several ways, such as difficult falling asleep or frequent awakenings, early rising, daytime tiredness, or memory lapses, forgetfulness, or difficulty recalling information, or cognitive issues like sluggish thinking, confusion, or poor concentration, or mood disturbances like anxiety, depression, or irritability. So, when insomnia becomes persistent or severe, it often leads to sleep deprivation. So, one of the most concerning outcomes is daytime sleepiness, so which can be dangerous during activities that demand focus and alertness, such as driving or operating machinery, or beyond fatigue. Chronic sleep loss raises the risk of several health conditions like mental health risk, or cardiovascular risk, or metabolic and physical risk, or daily functioning risk, like daytime sleepiness, cognitive impairment. So diagnosis of sleep disorders involves a clinical assessment of medical history, symptoms, and sleep patterns. And for insomnia, two primary treatment approaches are recognized. The first one is CBTI, is cognitive behavioral therapy for insomnia and um, medications. So CBTI evidence show that it can help to um, is the preferred initial treatment for adults struggling with sleep and considered as gold standard non-drug treatment. So it combines patient education with specific behavioral and cognitive techniques. So medications like hypnotics or sleep-inducing drugs can help to the patient to get to sleep easier. So there are many types of alternative therapies like acupuncture can help to increase total sleep times, or acupressure it can help to improve sleep efficiency and reduce time to fall asleep. Herbal remedies may help with sleep onset, support insomnia treatment, low blood pressure, detoxifying or improve REM sleep. Ayurveda can help to treat insomnia um, as a systematic imbalance of the body's energy, not just a sleep disorder. Yoga, of course, is increasingly recognized as an effective complementary therapy for insomnia, helping calm the nervous system, reduce stress, repair the body for deep rest. And a range of yogic methods are applied to bring the harmony back to the mind and body, fostering complete well-being. So there are some yoga techniques that for your treatment of insomnia, including the diet like sapic food, avoid heavy, spicy or late night meals, or lifestyle. One should follow a structured bedtime routine like early dinner or calming teas and structured bedtime rituals like avoid stimulants, books, movie before bedtime, or oil massage and practice positive thinking. It means one should understand how the mind operates and letting go of the struggle with rest. Or practicing meditation can help to reduce hyper-arousal, calming stress-related brain activities, and breaking the vicious cycle of negative thoughts and about sleep. That can help to restore balance by enhancing emotional regulation, lowering cortisol, and improving sleep architecture. Some asanas that can help to promote parasympathetic nervous system can help to stimulate pituitary and pineal glands, can help to enhance digestion, relieve mild depression, reduce stress and heaviness of the body, preparing for sleep. Cleansing technique like Kapalabhati, Agnishotra can help to um, energize the body and clear the mind, cleanse the respiratory system, boost energy. Yoga Nidra. Yoga Nidra is very good for calm the mind and can help the body to increase the awareness of oneself so that they can relax. They can help to relax the entire nervous system, body, and mind, remove disturbing thoughts and tensions, more focus on one awareness, increasing the awareness of oneself. And Omkar chanting or mantra chanting is a supportive practice to calm the nervous system, reduce stress hormones, promote meditative brainwave activity, can help to lower anxiety, enhances sleep quality by balancing both psychological and physiological processes. So teach yoga, heal everyone, help them, and when one realizes the self, everything happens. That the teaching from Swami Satyananda Saraswati. Hari Om. Thank you so much.